Well, welcome to the healthcare information session this evening. It is June of 2023, and we are excited that you're here or going to be able to listen to this later on. We're specifically going to be talking about our fall classes tonight. So we are going to get started here. This will be recorded so that if you want to listen to it later, if you want to go back and listen to different sections of this, you can. And so because of that, we do ask that you just hold any personal questions for the end. So my name is Anna Teeter, and I program all the healthcare information, allied health care classes here with Workforce Solutions. I've been here about 7 years. We've built some fantastic programs, so I'm excited to share those with you today. I'm going to share more about our catalog that's going to be coming out, and we are going to be talking about financial assistance, things that you need to know. Unfortunately, it does look like Beth isn't going to be here tonight, but I will cover some of those pieces. Or April is here as well. She might jump in too. We will talk about the nurse aid program. If Terry jumps on, she's going to share about that. If not, I'll cover that as well. Cover medication aid, medical assistant, phlebotomy tech, patient service representative, dental assisting, and then just a couple of other classes that we offer. I'll cover those as well. And then we'll have questions at the end. So my whole goal with all of this is to give you the information that you need to make the best decision possible. So we are going to cover kind of what to expect in the class, as well as what to expect in the job. We've had students many years ago that would get into the class and be like, I didn't know we did that. We want to avoid that as much as possible so that when you really sign up and register for these classes, you know what you're getting into. So the first thing we're going to do is talk about financial aid. And I like to cover that first because sometimes it feels like, how am I even going to cover this? So I like to cover it so that at the end of the day, as we're going through the rest of this, again, you'll be able to make an informed decision, and also to realize that there's so many funding options available. So we are going to go through those, and I'm going to go through them by kind of looking at the website. So I have a screen up right now. I'm going to actually stop sharing and I'm going to go live here for a second. And we are going to go to the Laurel Ridge website, and it's laurelridgeworkforce.com. And I like to share this as well because sometimes it's hard to find different things on a website. So it's helpful sometimes if somebody shows you where things are at. So I'm going to go back to sharing this again. And so again, that's laurelridgeworkforce.com. And if you log in, this is the page that you'll go to. And we're going to look under this tab called Funding and Policies. And I am just going to click on all funding options. So the good news is, there is, like I said, a whole bunch of funding options available. For the majority of the classes we are going to talk about tonight, they are considered fast forward programs, and they do come with funding. The only exception to that at this moment is dental assisting. And I'll get into all those reasons why here in a bit. But so fast forward is a grant program that the state of Virginia has put out, and basically they will cover 2/3 of the cost of a class as long as you've been a resident of Virginia for at least 1 year. You do have to prove that you've been living here for a year. Once you've done that, you're eligible. They don't look at income. They don't care how much money you make. You could be making $1 bazillion. They don't care. They just want to see that you're a resident of Virginia. With the intention of staying and working or moving forward in this field or in a field similar to this. So they will right off the top pay 2/3 of the cost of the class. When you complete the class, we get the second third back from the state. And then when you get your credential, we get a third back from the state. So the agreement with the state that you will sign at the very beginning is if you do not complete the class, you do owe a second third. So we want to make sure students know that. So no matter, once you've signed on the line, you've started the class, you're in it to win it. It's yours. If for whatever reason you can't continue, no matter what those circumstances are, then you would be responsible for that second third. And the state does like their money, so they will garnish your wages until they get it back. So it is not a joke. We do like to take that very seriously. But the good news is if you're serious about it and you really want this class and you really want to complete it, all you'll ever pay is that first third. Now, say that first third is still too much. The next step would be that we have something called Fantic, and we also have something called G3. So you would have to provide and show that you have financial need. You do that by getting your tax transcripts to us from the previous year. We look at that and we determine whether or not you might be eligible. If you are eligible, it can cover that entire first third. So you could potentially pay nothing up front in order to take a class. Generally, with most of these classes, it's covering your books, your tuition, your certification exam. Everything is included in that. So as you can see, that's pretty fantastic. If you have, or if you want an idea of what, oh, perfect. I was going to actually just pull it up on the website. I think it's under, is it under this one? Sorry, bear with me here. There is a chart. Oop, that's not the right one. I apologize. I think it's under this one. Yes. So here are the income guidelines. So it is based upon where you live. So if you're in Loudoun County, it's different than Frederick County, then it's different than Page County. So we do have to know where it is that you're residing. But then it is also based on the number of people in your household. So the guidelines for Fantic and G3 are based on this 4 times the poverty level. This was just recently updated. So if you make under $58,000 as a single person, you would qualify. As you can tell, these numbers are pretty high. For a family of 4, if you make under 120,000, you would qualify for G3 or Fantic. So again, this is on our website under funding options. You can pull up that chart. Also, depending upon where you live, we do have a bunch of different locality scholarships. These are on the website as well. We have some for Warrenton, Stanley. There's a little bit of money left in Shenandoah from what I understand. I just asked this morning, and a little bit left in Warren. And the town of Luray has some as well. So if you live in any of those areas, certainly ask about this funding as well.
I think that's the town of Stanley, not Luray. Just to clarify.
I think it's both, actually.
Oh, okay, great.
When I asked someone this morning, I think it was still both.
Okay, great.
Actually, it sounded like there was more money in the town of Luray than even in Stanley. So all that to say is, if you are interested in a class, please don't let finances hold you back. Come have a conversation with us. Call our operations team and we will walk through your specific situation and see what help is available for you. Chances are we're going to figure something out. Worst case scenario, there is also Sallie Mae loans available for a lot of our programs. We certainly want to avoid that whenever possible. But just know that that is an option if it really comes down to it. But again, as you can see, there's so many other options available that hopefully that would not be the case. So while we're on funding, April, is there anything you wanted to add about funding that I missed? Okay. All that to say is give us a call. We'll walk you through it. While we're on the website, I do like to point out just a couple of other things that I feel like are pretty helpful to know about. Under courses and programs, there is a tab called Course Catalog. That is actually the digital version of what you might be getting in the mail, hopefully this week. It's supposed to come out July 1. So it is not actually out there yet, but it is coming. If you did not get that, you can go to the website and look for it here. The cool thing about this catalog, now this one is not updated with the fall stuff. They might have just done it. They did, since I looked this morning, the fall one is out there. So the cool thing about this is once you log into this catalog, you can go to the page and I'm going to go to page 9 where the healthcare section is. And if you scroll over it, maybe it won't do it right now because I literally just updated this. Generally, when you scroll over this and you click on it, it's going to take you right to all the sections. So even if it is a little bit outdated, once you click on it, you'll see all the classes that are available in it. There are a lot of times where we update dates and times, sometimes unpreventably after this has been printed. So your best option to find out exactly what those dates and hours and times and all that stuff is online. We also frequently just add sections too. If a class fills up and we have a need for another one, we will oftentimes open up another section. I'm going to click on this one to just show you that because I know it did it on this one. Yep, see, it'll highlight it. So I can click on medical assisting. And then you will see all the sections that are going to be offered and where they're offered and all the details. Once you're kind of on that page, here's the one for Luray. I can click on it. It'll give me more information. Oop, I do have to click learn more and register at that point. And then here is the information about the cost, what it looks like for full price, what it looks like for fast forward, and then what it looks like for either Fantic or G3. It gives you more information. It gives you handbooks and everything you need to know with regards to that. And then it gives you all the class schedules. So you can see exactly what Saturdays this class meets on. So you can determine if this is really going to work for you. So that is a great way to just navigate on the website. And I'm just going to go back here. Again, that's where our course catalog is listed. Again, under courses and programs, this is where you can also go and navigate, where classes are enrolling right now, if they're in person, if they're online. There's a lot of just great tools on here. If you click on the fast track career training programs, all of our student handbooks are listed under this tab, as well as just important information you need to know. So that's the last place I'm going to take you to here really quickly. I'm going to click on that. And you can see the different areas that have student handbooks. I'm going to click on healthcare programs. Under this page, you'll see a couple little videos from our instructors that talk specifically about that area, sort of like what we're doing tonight, but in some cases it goes a little bit more in depth. There are a couple on here that we're working to update hopefully this week. Generally content's about the same, but there's still a few things that say LFCC on them. So we're working to get those revamped. You'll also see I made a little video about our student handbooks and what's covered in the majority of our student handbooks. So that's a great video to watch to just get a sense of what our expectations are going to be, as well as what you can expect from us. Then the student handbooks are there, so you can read those ahead of time as well, so you understand. It's kind of like a syllabus. It gives you a good idea of what our attendance requirements are in order for you to complete the class. And then we have some frequently asked questions on here as well. So just a lot of great resources. Sometimes it's not always easy to find what you're looking for if you don't necessarily know what you're looking for. So I really like to point out where those things are located. Janet, am I missing anything?
I don't believe so.
Okay, so that was funding options. I already kind of hit on the catalog again. It should be coming this week. And if not, it will be online. The next thing that I really love to hit on before we go into all of these areas is part of my role is finding out what classes should we offer? What do businesses want those classes to look like as far as are they going to hire our students? And then putting it into production and hiring the instructors and all of those pieces. So I always am looking at the job market. So I pulled these as of last week. These numbers are just for our Laurel Ridge area. I will give a little disclaimer. I do like to put the wages in there. Sometimes these are a little bit funky depending upon how employers post those within some of the websites. They could be slightly off, not crazy off, but this at least gives you a general idea of sort of where these roles are at this moment as far as active job postings. This is just within the last 6 months. And then some of those wages associated with that. Again, this is just within Laurel Ridge. Now, I also like to expand that a little bit. And I like to look at surrounding counties around where Laurel Ridge is at, depending upon where you're located. If you live in Winchester, it's not a super huge deal to go to Martinsburg or to go to Hagerstown. It's a 45-minute drive. So I like to kind of include that. Again, kind of southern region. If you want to go to Harrisonburg, if you're in Luray, you want to go over to Charlottesville. If you're in Warrenton, want to head towards DC, Manassas. So all that to say is when I calculate those areas in within about a 45-minute-ish drive, those numbers just blow up in terms of what is open and what they're looking for right now. So as you can see, medical assistance, I'll look at that specifically. I'm going to jump back one slide. Right now, just within our region, there's 125 active job postings within the last 6 months, 125. If I add those surrounding counties and areas, there's 506. So as you can see, there's a huge need out there. Dental assistants as well. If you look at just within our region right now, there's about 60. And granted, we only put out probably 2 classes a year. Max of 16 students. So at the very max, we're only putting out 30 students a year. So we're not even touching the need within our own region. If I expand that out to the other counties, there's 253. So all that to say is when you're asking, can I find a job? There are jobs out there and they're available. If you can do a resume and get yourself an interview and pass, those steps, those jobs are available. I certainly cannot get the job for you. I can't go on an interview for you, so I can't guarantee anything, but this is just to prove there are jobs out there and they are actively looking and needing them. So next we're going to jump right into the programs. Again, I like to really share what you can expect in the class as well as in the field. So as a nurse aide, it is an entry-level position within the healthcare industry. You are always under the supervision of an LPN or an RN, and you do direct patient care. So a lot of times you're doing this direct patient care in assisted living facilities, and it's for people that generally cannot take care of themselves. So you're doing everything to help provide that care for them. I will say that there are requirements for this class. There's a background check, drug screen, physical, immunizations, and you do need your BLS CPR certification. And that is because clinicals are a part of this class. So you're actively going to a place and you have about 40 hours of clinicals, I believe, just as a part of it. Upon the completion of the program, you are eligible to sit for the certification to become a certified nursing assistant. They're usually employed at assisted living facilities, home health agencies, and in some areas of the hospital. You could be doing anything from bathing to obtaining vital signs, feeding, incontinence care, monitoring intake and output of fluids. There's a huge need for nurse aides, and we will sadly probably never meet the need that is out there. So if that is of interest, we certainly encourage you to check this out. The great thing about nurse aide is you can go into this field and stay in this field. Some people go into it, love it, stay there. Some people get into this field and then they realize, wow, I could be doing what they're doing, and they continue on their way. There's a lot of RNs, BSNs, MSNs that start as CNAs. So there definitely is a career pathway available within this realm. Or like I said, you can go in and be a nurse aide and love it, and that is your passion. And that is fantastic because, again, they are strongly needed all throughout our region. If you do, or if you are interested, this is a more credit-based program. So I would encourage you to reach out to someone at the credit side, one of our advisors, and you would do that through going to our website and go to laurelridge.edu/nurse aid. And that'll put you on the path to get you connected with the right people. I believe that there are still plenty of spots available for fall, but I would recommend that you register soon and don't wait, because like I said, there are background checks, drug screens, all those things do need to be completed very early on in the course or before the course starts. So a great next pathway for nurse aid is to become a medication aid. And so those who want to stay in the field typically will pick up nurse medication aid certification as well. This is the only pathway other than a DSS approved 40-hour course. And I've only ever had like 2 people ever do that in the entire time we've had it. So you need to have your nurse aid cert. You have to have completed an approved nurse aid program in order to get into this class. We do verify that ahead of time. This also has those same type of requirements because you do clinicals as a part of this class as well. So you do have to have a background check, drug screen, physical, immunizations, and your CPR in advance of starting this class. It is 68 hours, fairly quick. It does include those clinicals. So you do have some days that you will be off-site going to do those. A medication aid is kind of like what it sounds like. They help administer medications or help patients administer medications in specific settings like long-term care facilities and assisted livings, and also the regional jail often will look for medication aids as well. They are typically not found in hospitals. So if you're wanting to work in the hospital, you can certainly work there as a CNA, but you're not going to work there as a medication aid. There are other settings for those. So next is going to be Janet. And Janet, would you introduce yourself?
I'll be happy to. So my name is Janet Mays. I'm the Allied Health Program Lead, and my primary role is to instruct courses at our Middletown campus. I've been with the college for 4 years, and I really do love what I do. I loved earlier, Anna said, if you're in it to win it. So if you're in it to win it, a medical assistant, phlebotomy, they're hands-on programs, and a lot of people just really find an interest when you're busy and doing things. Our medical assistant program, because we have it at some different campuses, your class will typically meet 2 to 3 times a week, depending on the schedule of the course that you choose. It is important that you have regular, reliable internet access. All of your homework components will be done online. The program is a complete 160-hour program. Medical assistants are oftentimes, their main employment is going to be doctor's offices, but there are some specialty clinics like OBGYN or cardiology, certainly urgent care centers, but even with insurance companies. Medical assistants have a variety of fields that I talked about earlier, some additional ones, orthopedics, neurology, oncology, internal medicine are also some types of clinics that you might work in. Medical assistants usually have a set schedule. Think about your doctor's office that you use, what their hours are, primarily first shift, not open on holidays or weekends. Urgent care settings are certainly the exception to that. I'm not sure what happened that I lost Anna, but what I'm going to do is I'm just going to bring up the PowerPoint for myself, if you'll give me just one moment. Let's see. I am going to have to click out and get that. Give me just a second, and then I'll keep going with the medication aid. 1 second, or excuse me, the medical assistant, not the medication aid. Let me keep going with that 1 second, and I'll have it up. Sorry, of course, it's wanting to take just a minute to load here because I didn't have it up in advance. All right, I'm just going to pick up where Anna left off. So give me just a second to scroll to that slide. Okay, medical assisting. All right. So from the current slide, and now I will be able to share the screen. Okay. All right, so our medical assistant program, we went over the places that you traditionally would be employed, which is a doctor's office, but you could work in urgent care centers. Certainly, a lot of people like to do that because they tend to have 12-hour shifts, and that may work best for your work-life balance. Medical assistants in our class, you're trained to do these skills and many more. We learn how to draw blood, give shots or administer injections, how to do the clerical side, so schedule an appointment, how to take an incoming phone call. We learn that front office component, everything from checking you in, getting you ready, verifying your insurance, to checking you out and making your follow-up appointment. On more the clinical side, we do things like dispense medications, call in prescriptions, assist with procedures like suture removal, obtaining vital signs and patient history to ready them for the provider. We also do things like EKGs, point of care testing, and all of this we get to practice in class. The skills are practiced on your classmates, so on one another, and participation is mandatory to make sure that you are successful. The phlebotomy technician program, it is the program that oftentimes people like as a introduction. One second, I'm going to send a response. The phlebotomy technician program, again, a 55-hour program. It is intense. It is essential that you be in class on time and prepared. You are required to have a minimum of 30 live venipunctures and 10 capillary sticks, which is a finger stick, before you can sit for your national certification exam. We do also learn collection and processing of non-blood specimens like urine specimens, wound or throat cultures. Again, skills are practiced on each other during class. Participation is mandatory to ensure your own success, but the success of your partners as well. It is pretty intensive, but I have found after doing this for 4 years that once you've done it a few times, it believe it or not, it does become routine, and you honestly get used to it. Phlebotomy technicians are often employed in hospitals, labs, donation centers, insurance companies, home health agencies, other skilled nursing facilities. And there are some flexible schedules that are available to meet your needs, depending on where you want to be employed. So I'm not able to speak on these other programs as well as Anna would do, but I do know that they lost power at our Middletown campus. So I'm going to continue with this presentation so that we're able to do this recording. The patient service representative is often the clerical side of the doctor's office. It's a part of what you do as a medical assistant for the certified clinical medical assistant, and you are doing the front office duties. They have a lot of different names: patient service representative, medical administrative assistant, medical office assistant. It really just depends on where you're employed. You are oftentimes in charge of medical records and setting up the patient's medical record in the electronic health records section. You may work as the office coordinator. You may process referrals. You may schedule patients for EKGs and x-rays or outpatient services that need to be done outside of your facility. Primarily, again, they are in the doctor's office. You have a program that is in depth in medical terminology, because that is an important part of this class. You do practice in an EMR or an electronic medical record. Classes are done live online or face-to-face in a classroom setting. This course is 60 hours long. This training will allow you to sit for the National Certified Medical Administrative Assistant exam offered through the NHA at the completion of your course. And again, that exam is a part of your course fees. The dental assisting programs. So dental assistants are a valuable asset to a dental practice. Sometimes they work as the administrative assistant for the dental office. They work directly with the dentist to provide care, but they may also do more of the clerical duties. Each place you're employed, it will be different. You will, as a part of this program, earn both your basic life support CPR certification and a dental radiation health and safety course is included in this program. You will be trained in both clerical and clinical functions because every office that you apply to may need to use you differently in their particular office. The dental assisting program is quite intensive. It's very similar to the medical assisting program. Your duties could include welcoming patients to the office, setting up the supplies, equipment, and instruments that are needed for the procedures, sterilizing and taking care of the instruments, following regulations regarding sanitization, assist the dentist, undertake lab tasks for processing specimens if necessary, provide oral hygiene and post-operative care instructions to patients. So you'll do some patient education. You'll be responsible for keeping the dental room, exam room, as well as the office in general, well stocked and neat and tidy. You'll take x-rays or intraoral photos. And again, you are trained in that. You'll assist front office staff with scheduling, billing, insurance processing. And overall, this class will cover many of the different areas that you could work in as a dental assistant. And there are even specialties within that. Surgery, pediatrics, orthodontics, family dentistry. There are so many options out there available to you. Some additional classes that we have through Workforce Solutions, we have the basic life support CPR classes, which are desired by many employers for both the medical assistant and the phlebotomy programs. But we have them, they're pretty regular. It's a one-day program, but they are included, as we discussed, in some of our programs. We have the Serve Safe Food Protection Manager certification. So if you want to work in the food service industry, someone has to be responsible for making sure that all of the education that you need to keep food safe from spreading germs is included in this course. And we have other online courses out there. We have courses, of course, outside of healthcare, but this is the healthcare need to know session, so we're not going to go into those, but we have many courses out there that can help you. If you do enroll in our classes, we again encourage you to visit our website and look at some of the online tutorials to help you learn how to use Canvas, which is our LMS or learning management system, so that you'll be prepared for navigating your course in the first day of your class. And as you're trying to adjust to maybe a new work-life school balance, having those things kind of under your belt before you need to use it can really be helpful. Our student handbooks, again, laurelridgeworkforce.com. And then if you add /HNTK, which is healthcare need to know, we are still working on updating some of the videos. So I encourage you to look back and to see those and see what we covered. I know that we have already updated the medical assistant video. I think it's pretty awesome. We have some other videos like, are you new to Canvas? Are you new to Zoom? What classes and computer internet requirements are out there? Usually most classes, if you do not have a personal computer, we have one that we can loan you. Or sometimes our college library has some that they can loan out as well, and we'll put you in touch with the resources that you need for that. We also have some Canvas training tutorial videos, so you'll learn how to navigate that Canvas course. Most classes that you register for, you will receive an email about 1 week prior to the course start date, telling you to go in and look for your course. Some instructors choose not to publish their course until closer to the start date, but at a minimum, your course should be available for you to see in Canvas 72 hours before the start of the course. Again, a lot of instructors publish it a week or so out so that you have a chance to learn some navigation. Let's see if there's anything on the next slide. Just our general information, contact information, laurelridgeworkforce.com. And then you can email us as well at workforce.edu. I'm not sure if that's the correct email. I will have to look that up. But our phone number is 540-868-7021. We're there Monday to Friday, 8 to 5. Friday's a little bit different, 8 to 4. We do currently have some summer hours, but those will be ending soon. And we really thank you for your time and attention. And the first step you've already taken towards your own success, which is listening to this video, learning the different pathways that we have available, and finding out what might be best for you. If you have any questions, please contact us, and we look forward to having you in one of our upcoming classes. Thank you.